Hello. Yes, please come on through. Right, if you wouldn't mind just coming and taking a seat right there for me. All right. Yes, please close the door. Thank you. Hello, lovely. How are you? Good. Thank you for coming in to see me today. I'm Dr. Nicola, and it's a pleasure to have you here. Alright. Would you mind just telling me your full name and date of birth, please? Thank you. Perfect. Have you been to a dermatologist before? Okay, so this is your first time. Alright. I do have your referral here from your doctor, and I can see that you have concerns with acne, scarring, and things like that. Yeah, alright. Do you have any other skin conditions at all? Alright. I won't ask too many questions because I think it's important just to get straight down to the exam. Alright, but first of all, could you just tell me if you're on any medication? Okay. And are you allergic to anything? Okay. And are you up to date with all the medication? Good. So I can see that your doctor is obviously concerned as well, and that you have tried some different antibiotics and some products on the skin, and you've not had any joy. Yeah, alright. Do you have any health issues at all? Okay. Alright. And what about any mental health issues? Okay. So, health issues. With your mental health concerns, does it affect your sleep at all? Alright. Would you say you're getting a balanced diet and enough water intake? Alright. Okay, well, don't worry about that. Do you find that some things can make the flare worse? A bit of stress, lack of sleep, any foods in particular? Alright. And how long has this been going on for? Okay, so quite a while. Would you say it's got worse or exactly the same, or does it go up and down? Okay. Alright. I don't need to ask you anything else at the moment. Alright. Do you have anything on your face at all? Alright. I will just wipe over, if that's alright, but first I will need to take a swab of your face. Alright. So I'm just going to swab all over your face and jawline. Alright. Alright, let's get yourself comfortable, okay? And just relax for me. Alright. Tilt your head back for me. Thank you. Wonderful. You can relax. Just going to wipe over your face with a sterile wipe. Okay. Good. Right. leave that to dry. Alright, and please don't touch your face. Thank you. Right, it should be nice and dry now. I'm now going to assess each area in turn, as well as your hairline, jawline, and your ears. Some areas may hurt a bit or feel a little bit uncomfortable. If it does get too painful, please let me know. I'm going to be feeling skin tone, texture, checking the elasticity, checking for any dehydration, oiliness. I'm also checking for any inflammation, swelling, any redness, flaking, and bleeding, and anything like that really. Okay. How's that so far? Good. Not quite painful there. What about there? It's here, it's very inflamed and very red. And actually quite dry in some of the places around the spots. They look a lot like boils, the majority of them. Do you find that it looks like that often? I mean, I can definitely see some whiteheads. Yeah. Do you find that nothing kind of gets rid of them? So once they're there, they're kind of there to stay. creasy there besides the nose. Do you get that quite a lot beside of the nose? Okay. And there's a few comedones around on the cheek area, and I can see quite a lot of scarring there, and again there, so around here and around here. Alright, here you find that you've got a lot of your acne clusters. Alright, mainly boils, but also a lot of whiteheads and some comedones in between as well, which has shown to me that you have a lot of blocked pores. Alright, which is not helping the acne. Yeah. Alright, let me have a look at your nose. A little bit oily down the centre. Do you get that a lot, or? You have a fair few comedones in the centre here, and a couple at the end of your nose. Any pain there? Okay. What about there? Good. And what about here between your brows? Okay, there are quite a few comedones there as well. Alright, so I think we could definitely do some extraction between the brows and down your nose for definite. I'm a little bit unsure whether I want to touch the ones round by your acne at present. I don't want to cause any infection and, you know, make things worse for you. Alright, but you can definitely work on this nose. Definitely. You've got, you know, some quite stubborn, quite deep. Some should just wobble out a little bit. And the ones on your cheek area are definitely quite stubborn. Alright. Okay, I'm just going to look at your upper lip. That looks perfectly fine. Okay, your lips, do you ever have any cold sores at all? Okay, that's good. What about any ulcers in your mouth? Okay, wonderful. Right, I'm now going to have a look at your chin. I can see already a lot of comedones. Some are quite deep. And you do have quite a big cluster on your chin area. Alright, so it's on your right side. Okay. The other side isn't too bad. Yeah, some of those are quite deep. Any pain there? Okay. Some of them might come out. Looks very sore and dry around the edge of the biles. Tilt your head slightly. I'm just going to look down your jawline. Not too bad. A little bit bumpy, but I can't see any breakouts or anything like that. Okay, pop your head back for me. Thank you. Gonna have a look at your forehead. I'm going down the sides by your eyes. And it's quite oily. Is that normally like that, or okay? Well, that's good. Just seeing if you have any in your brows. They feel quite nice and smooth. I can feel some spots forming underneath your skin. Yeah, so they haven't come out yet, but they might do very quickly. We'll find it would literally be the opposite and they just stay underneath. Yeah. Or they come out after a while. If you could just close your eyes for me. Thank you. I'm going to press over your eyes. Can't feel any spots there. Probably do something to help tighten up your eyelids. Yeah. Your dark circles are a little bit prominent, especially more here by your nose, alright, so like there and round. But again, you know, we're focusing on the acne, but I know you said you would like me to point out any other issues, alright. Around about here, so below the dark circle, you have a little bit of pigmentation. Nothing too excessive, alright. It's probably down to just a little bit of sun damage, but I'm not concerned by that at all. No, don't have to worry about that. Okay. Right, so I'm just going to have a look at your hairline. Yeah, I can't feel anything in your hairline, which is great. Okay, I'm just going to feel around your ear. Feels great. And I can't see anything as well, which is good. Check the other side. Again, that looks really good. Alright, so no problems in your hairline, not much on your jawline, just a little bit of lumps and bumps which is underneath your skin, same as on your forehead. Okay, the congestion with the comedones are about between your brows, down your nose, some dotted in between the acne. Okay, your chin has a large cluster on the right side, which is quite bad. The other side just has a few little whitehead spots. Okay, and your forehead has some boils that are underneath the skin. Alright, and as I mentioned, they may or not come up. And then you've got the scarring right here, right down to that little bit there, to down, like so, just right there. And I can see that there is scarring right next to your acne, and in there as well we have the congestion of the comedones. Alright, yeah, we have a lot we can work on. Alright, okay, I'm just going to have a look with my light now. Close your eyes if you wish, or you can keep them open. Alright, I'm going to start by having a look down your nose and between your brows. Good. You're really quite deep. Just going to have a look with my magnifying glass. Yeah, they really are. Okay. Between your brows. Alright. See that. Okay. Okay. Beyond your chin. Yeah. Yes, definitely. Okay. Okay, I'm just going to wipe over your face with some damp sponges. Okay. Tilt your head for me. Okay, I'm back. Okay, let that just dry. I'm now going to exfoliate your skin and apply a hot towel. This is just prepping the skin for the extraction, okay? This product is quite cold. It has some scrub in it, but nothing too abrasive, okay? I'm going to work it all over your face and then concentrate on the areas of concern, alright? It is cold. Is that feeling alright for you? So no stinging or anything? Okay. tilt your head slightly. Okay. Okay, and relax. Okay. Tilt your head for me. Okay, I'm back. Good. Let's leave that to dry, and I'm going to get the hot towel. Okay, just close your eyes for me. I'm just going to place it all over your face, so just take a nice deep breath and hold. And breathe. And another one. Okay. Okay, just try to breathe normally now. Just get the other bit that's hot. Feel alright? Good. Perfect. Feel alright? Good. It is actually, isn't it? But it does make you feel a little bit cold once you take it away. Right. So please don't be alarmed, but these are my extraction tools. Okay. So this is just the pre-extraction solution. Okay, this will be quite cold. Start on your nose. Yes, it is. I'm going to on your chin and on your cheeks still, okay? Perfect. Great. I'm now going to put on these little crazy looking glasses. Okay. Do look very weird in those though. To make sure the lenses are clean. Finding the right position for them, you see. Let me just have a look. Perfect. Okay. Okay. Just going to do some gentle presses That's it, summer lifting already, which is good. Right, I'm going to target the ones just there. Okay, that's it. We'll have to push quite hard and wiggle. That's it, that's coming out nicely. Okay. Lovely. Small one now. Push, wiggle. That's it. Come on, squeeze it out. Wonderful. Perfect. I'm just going to gently pick up the ones that are on the surface. Perfect. There we go. Press, 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 squeeze. And there we go. How's that feeling so far? Good. Okay, I'm going to press nice and firm down your nose. Push, 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 push. Wiggle, 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 push. That's good. Great. It's looking good. Okay. It's looking a lot clearer. It's really good. Okay, I'm going to just work between your brows now. Okay. Press, 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 press. Hold. Wiggle. Release. Press, 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 press. Wiggle. Hold. And release. Oh, wonderful. Nice amount. Now I'm going to work on this little stubborn one. Okay. Push. Come on. Okay, now let me try the bigger end. Come on, that's much better. It's nearly there. I know, I'm sorry. You're doing really, really well. Wonderful, it's gone. Just scoop the rest of it up. How are you feeling? All right? Good. Oh, these do make me very hot, you know. Yeah. Right. Yes, quite a few nice ones have come out now. Wonderful. Okay. Good. Perfect. I'm going to have a look at your chin, see if there's any that I can get away with. Ah, yes, I could do that one. I don't want to do too many in one go because it can be quite stressful. Oh yes, that one's coming nicely. Thank you. And I can see a really stubborn one, so I'm going to use my other one. Yeah, that's going good. Wiggle, push, squeeze, circles. I need to go with a smaller one, I think. That's better. Should be able to pull that out now. Oh, perfect. Lovely. Just going to finish off by having a look at the cheek area. I'm just going to press. I'm going to see if any just come up naturally. I'm trying to be careful of the acne. Okay. There's quite a few actually. Wonderful. Fantastic. Okay, I'm just putting on some after extraction product. Okay. Yes, nice and soothing. Healing properties. Some aloe in there as well. Okay, just let that soak through, alright? Right, so this is some toner, and this is just going to help close up all your pores. All right. Good. let that soak in. I'm now going to pop on a serum, and I'm going to use this special facial massager to let it penetrate deep. Okay. 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 It's nice and gentle, so it won't hurt your acne. It's quite nice, isn't it? It does feel a bit funny down the nose. Final product is a special Retinol A strong strength oil. Okay, so to pop that on. Right. Okay, so this is a nice pulsating one. It's really going to help that retinol going to the skin. It's really going to help push it right through. Wonderful. Perfect. Absolutely perfect. How are you feeling? Yeah, I'm a little bit hungry actually. Yeah, it's time for my lunch, I think. Don't worry, I'm not going to keep you much longer. Right, so I'm going to leave all those products on your skin. Okay, I would like them to just penetrate down and do their job. Please refrain from touching. All right, my love. Okay, just going to get your notes and then I give you a couple of recommendations and then I'll let you go and have your lunch. Anything nice? Okay. I'm not too sure. I think I'm just going to have a sandwich today. Yeah. Okay, my love. So you definitely have acne, all right, and acne scarring. Okay, so I need you to try and drink plenty of water, have a balanced diet, don't keep touching your face, that's very important because you don't want bacteria from your hands getting on your face. Okay, and make sure you've got clean hands if you do touch. Yeah, I need you to cleanse, tone and moisturize twice a day, preferably with an acne medicated treatment, which what I can provide for you, or just with acne prone products, okay, on the market. But try to find some good brands, okay, like Dermatologist and other brands like that. Okay, good. I want you to not pick, not pop, not squeeze, if you don't mind. I'm going to give you a Retinol A topical cream. You wouldn't have had this one, okay? It's very similar to what I popped on you today. And I need you to apply that only to the areas though, because it's slightly a bit stronger than what I used on you today. Okay, so just the areas where the acne is. Okay, try not to get it on any other part of the skin. Okay, so I'm going to do that prescription. So remind me of your date of birth again. Thank you. I will write all this up properly and send the report to your doctor and yourself, okay? But can I just get your address? And your postcode. Thank you, that's great. So I'll send it to you, okay? I'm also going to give you a special acne preventer, and that's going to go all over your face, okay? If you can, I would like you to try and prevent stress levels. I know easier said than done. And try and get a good night's sleep. All right. Some fresh air will do you some good as well. I'd definitely say monthly medicated facials within clinic or with acne specialists. I'm obviously a dermatologist and an acne specialist and very advanced in all sorts of skincare and products and things like that, but there are some good products on the market that will be worth trying, okay? Some of them are not going to do anything, they're just spa based and help relax you and just give you a nice clean. We need to use products that are targeting those areas, okay, because we want to fix those problem areas as much as possible. I think down the line I might give you some Roaccutane if it's not going to work, if we're still having problems. Yeah, that's right, but I don't want to start you on that just yet, okay? For scarring, there is plenty of things we can do. I mean, we can do chemical peels, microdermabrasion, dermabrasion, laser. We've also got injections that I can give, which that would have to be in clinic, which is possibly the route I might start down next rather than Roaccutane. Okay. There is some other antibiotics that I can give you as well. Microneedling might be a good one to do. Okay. Next time I will have to give you a blood test because I need to check your levels just to see if you're okay to have the injections and other antibiotics and Roaccutane. Okay, and I will need to see you every month just so I can check your skin, check how your treatment's going and all sorts of things like that, all right, and discuss treatments and scarring and things like that. Okay, yes, it is going to be a long road, but I think we are on the right track. I definitely can help you, all right, and I think we'll work really well together and we can sort out that issue. All right, but here is your prescription, my love. So if you could go and get that for me today, that would be great, and start applying the products as I've mentioned. Okay, good. So do you have any questions for me at the moment? Okay, well, if you do have any questions, please just give me a call, all right? If you can't get through to me, then my secretary will answer and, we'll be able to answer your questions, get back to you as soon as I can. All right, my lovely. It's an absolute pleasure. All right, don't worry. We'll get through this journey, I promise you, and we'll sort out all those acne and all the scarring for you. All right. Yeah, that's right. I mean, there's things that you can take home, like treatments for, you know, skin. Then you've got certain lights you can pop on your face and use and treat at home and things. But we'll discuss that next time. All right, my lovely. You're very, very welcome. Well, you have a lovely weekend, all right? And enjoy your month. And I will see you soon. You take care now. Bye-bye.